Hello students, can you hear me? Hello
Good
students.
afternoon,
Yes,
ma'am.
ma'am.
Yes,
Good
ma'am.
afternoon. You are supposed to join early now at 1 o'clock now today. You don't remember? Okay, today the topic which I'm going to take is electronic patients record system. Have you heard of this electronic patient record system anywhere? Can you hear
No,
me?
ma'am.
No, ma'am.
No. It's NEIGHRIMS is using electronic patient record system here.
Yes,
Yes,
ma'am.
ma'am.
They
They
input
input
in
in
computer.
computer.
Hmm. Anything which we do electronically, okay? Any patient's record is a system where we do something not doing by hand or by manually. It is just done by electronically only, okay? So let's see. We are not doing enigmas, okay? So first of all, for the introduction, let us see what is a patient record, okay? We know when we talk about patient record, we know all the documents, whatever we have. Uh, excuse me. It's a documentation. Patient records is a documentation, right? What we'll record there? We record about the patient admission, about the patient visited, what medications they have been taken, what treatment was given to them, what care they have received, and how, and if any there is a referral of any care from other from the one place to another place. All this will be recorded in the patient's record. Yes or no? So it is a collection of documents that provides an account of each episode in which a patient visited or sought treatment and received care or a referral for care from the healthcare facility. Understood now that one? Patient's record? Yes?
Yes, ma'am.
Okay. Now, let us see the definition what it says. Okay. A patient record is a document relevant to patient's management. So whatever documents we are giving, whenever you do a documentation and a thing, when you go to the ward, we document it, right? Whatever care you have given, right? Unless you do the documentation, it is show if you don't do documentation, that means it shows that you are not doing anything, any care you are not giving to patients. Okay, so a patient record is a document relevant to patient's management, what care you are giving. Okay, it may be a medical history, it may be a chief complaint, a diagnostic. If any they have, you are going to take medical history first of all, then any complaint they have got, that also has to be recorded. Any diagnosis has been done, that also has to be recorded. Any treatment, any procedure has been done, and what is the current status. Everything arranged in a orderly manner. Okay, so that is a patient's record. Now in patient record system, one can be done manually. The others record, what we call is a patient record system is it's a fully integrated comprehensive method for entering the entire data of patient medical record in a particular system, usually called as electronic patient record system or computerized patient record system. Okay, whatever which is not done manual, whatever we do computerized or electronically, it is known as a electronic patients record system. That is understood, right?
Yes,
Yes,
ma'am.
ma'am.
Now, what is an what do you mean? The electronic. It is different here. Okay, it should be electronic health record. It should be here. Okay, so it is written. This one is wrong here. So I told you it is the electronic version of the client's data found in the traditional paper record. Whatever tradition till now it's going on, traditional paper record, whatever we do, that is we do in electronic version. Whatever the client's data is, like I told you, medical history, chief complaint, diagnostic, treatment, for law of referable cases. Okay, so it is done in the electronic version. Okay, so what is the role of electronic health record? Now there it represents the patient's health record. Okay, patient's health record, it gives about everything about the patient's health status. Okay, whatever patient's health status is there, they will record it there. Then medium of communications upon the healthcare practitioner. There are communications between all the healthcare practitioner. Maybe it is in the lab, maybe it is with the doctor, maybe in the pharmacy, everything. So there is a medium of communications. Okay. Okay, it is a this electronic health record is a medium of communication between all the health providers. Okay, so there also we have a legal document of the healthcare systems. Okay, then source, it is also source for clinical outcomes and health service research. So whatever it is also one of the sources from where you will know about the evaluation about the clinical outcome of the patient as well as the it also help as a tool for the research practices. Okay. And resources for practitioners education. Now resources for practitioner education means by seeing all the clients, every patients, they will have a health records. So giving treatment, giving referral, giving clinical, taking clinical outcomes. So this will be as a experienced doctors or the nurses, which will give them some education, so they will learn more. So here it means education means through experience only. Okay. Resources for practitioner educations. Okay. So if this system is there, there will also be an alert, will be there, reminders will be given, and at the same times, because of this, there will be a quality improvement of the patient's care. Did you understand that? So role of electronic health records means patient record means there will be patient's health records. The status of patient's health record. It is a medium of communication among all the healthcare providers. Legal documentation also will be there, and it is one of the sources for clinical outcome and research tool. Then it is also resources for the education part for the practitioners, for the healthcare providers, and they will also give us alerts, reminders, and there will be, at the last, there will be a quality improvement of the patient's care. Now, what are the data components documented in electronic health records? Okay, so in a nursing way, we can, in the nursing site, we can do administrations of nursing notes. Whenever the patient is admitted, we write an admission note. Okay, so that can be included in that. And daily charting, you have to, what things has been done to the patient's care, daily charting should be there every day. Okay. Then what physical assessment you have done, that also daily has to be done. The present complaint has to be recorded, documented. Then any diagnosis, any test, any procedure, any treatment, all has to be documented. Then whatever the nursing care plan you have given, that has to be documented every day. Medication administration, what medication administration you have given to the patient, what is the progress report, what are the laboratory investigations you have sent, what are the results of that, what are the radiological reports, if any referral to different department or different hospitals or different institution, and the discharge history has to also be recorded for every patient. Okay, so in every station there will be a one computer given to them, desktop, where they have to enter, everyone has to enter, whoever gives the patient's care every day. Understood? We usually do all these things in
Yes,
a
ma'am.
in the what you call nursing notes, right? Manually we do it, right? We have that forms, right? Yes or no? You do that, right? We have a nursing care format. We have their in the present complaint. You can write all these things. So this can be done by electronic health records also, and everything is done in the electronic versions. Okay, so you have lots of when you do this electronic version, you have lots of time to do anything also. Okay, to take to give more care to the patients. Okay, you have lots of time to give more care to the patients. Okay, you'll get, and discharge history also, it's also documented. Only if the patient at last, when they, if they require hard copy, at that time only we can give one hard copy of the discharge slip. Okay.
Yes, ma'am.
So all this thing has to be documented, all this data has to be documented in the electronic health record system. Okay, we usually do this in the one. Okay, now we have the component of electronic health records. Okay, so the components are, number one is clinical decision support system. Okay, then second one, we have a computerized physician's order entry, that is called CPOE in short form, and this one CDSS. And we have a health information exchange, this is HIE. Okay, now when you talk about the clinical decision support system, it is DCSS, it is a software. Okay, it is a software, since we are doing in the electronic version, that assists the provider in making the decisions with regards to patient's care. So patient's care you are giving, you are doing the decision, but the software will, this is a software which help you to assess. There will be an option for that. Okay, a standard format will be there, where you can choose it, but your decision is for the patient care is yours. But this software will help you to where there will be a standard format, it will help you to choose the option. Okay, got it?
Yes, ma'am.
You know what is a software, right?
Yes, ma'am.
And the computerized physicians order entry. This is, it provides the physicians and the nurses with real-time diagnostic and treatment recommendations. Okay, this also it is a computerized physician order entry. You have to do the entry. Though whether it is a physician or a nurse, they will entry all the documentations there in the system. Okay, so that they will know the diagnostics and treatment recommendations also they can give there. Now, what is the function of CDSS? Okay, now why you want to do this CDSS? Now, mainly to manage the clinical complexities. So there is no complexities in order to manage all this, okay, clinical complexity. Then if there is any medication errors that can be monitored there will be less chance of medication error will be there. So we can easily monitor the medication errors, and at the same time avoiding the duplicacies and unnecessary tests. So once they have been given again repetition of the states, it will be unnecessary and cost of and just wastage of time, wastage of money. So that can be avoided. So that duplicacy can be avoided and unnecessary tests can be avoided if we have that software. Okay. And also this time it also supports for the clinical diagnosis and treatment plan process, because I told you it is a software and there will be an option, and this will be easy for you to find out which the clinical diagnosis and what will be the treatment plan for this particular patients. Okay. Then fifth is promoting the use of best practice and condition certificates. So there will be guidelines I told you. So we will choose the best practices and conditions according to the guidelines they have provided to you. Okay. And at the same time, they will also provide the latest information about the drugs, what drugs to be given, and what is the side effects, what is the actions about the drugs. So they will provide everything about the drugs also, the latest information about the drugs. And it will also help you to, if the patient is having any allergic to any medication, this will also help you to find out. They will support you to find out all this allergic to any kind of medication to a patient. Then alerts for a drug interaction and other potential patient's issue also will be given to you. A choice will be given to you regarding drugs. Okay. So they will give an allotment of any drug interactions, and also if patients will have any other issues to the drugs. Okay, so you understood now the function? First of all, if there is any complexity of the situations, clinical situations, it can be managed, okay? And also at the same time, it will help you to monitor the medications errors, okay? And at the same time, duplicacy and unnecessary tests will be avoided. Then they will support you with the clinical diagnosis and treatment plan process. They will give the best option for the practices, and also they will give you the latest information about drugs. If there's any interactions, if any what you call if there's if the patient is allergic to any kind of medications, or if the patient has some other issues also, they will help in that. Okay, so that is a function of the CDSS, okay, system. Understood?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
Yeah, number 2 is a computerized physical order entry. Now, this is also a software, okay, that allows the physicians to enter the orders directly, that enters the orders direction directly into the computer rather than doing into the
Yes,
paper.
ma'am.
Okay, so it is also a software which will allow the physicians to enter the orders, okay, directly into the computer rather than doing into the paper. For example, what they will write about the drugs, they will write about the laboratory tests, they will write the diagnosis, they will write about the any radiological procedure to be done, any physical therapy to be done. Okay, so they will write directly, or they will put directly into the computer. Okay. Now, what is the benefit of CPOE? Now, it eliminates the potentially dangerous medical error caused by the poor penmanship of the physicians. You know that. You have understood this. So, the handwriting, sometimes it happens that there are medical error caused by
Yes,
the
ma'am.
handwriting of the physician. So, it will eliminate all those things. Okay. Then sometimes it eliminates the errors caused by unclear telephone orders. Sometimes orders also given by telephones, right? The doctor will give nurses the order about the medications. So there may be also errors because of unclear telephone orders caused by unclear telephones. So that errors can also be eliminated if you write directly to the computer. Now, makes the ordering process more efficient because nursing and pharmacy staff do not need to seek clarification of missing information from an incomplete orders. So we always sometimes we always have this incomplete orders, right? We have followed many times that there is an incomplete order. So now the nurses who's or the pharmacy staff whoever taking care of the patients, pharmacists giving the medication to the patients or nurses giving care to the patients, this will be more efficient. If they will do in CPOE, they will be more efficient because they don't have to seek the clarification of the missing information from the incomplete orders. Okay, after all, this is all going to enhance the patient safety. Okay, so all the errors can be eliminated, this will improve the patient's or enhance the patient safety. Okay.
Yes, ma'am.
Understood now? Benefit of CPOE? CPOE.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
The next point was health information exchange. Okay, so it is a process of sharing the patient's electronic health informations between different organizations and can create many efficiency in the delivery of the healthcare. So it is also it is a software, it is the same thing where you can share the patient's electronic health informations between the different organization, between different hospital, between different institution, okay? So that the patients get a effective delivery healthcare wherever he goes. Wherever he is there, he will get an effective delivery healthcare, what to say, proper healthcare if there is a health information exchange system is there. Okay, once the health data are available electronically to provider, it is facilitate the setting of because once everything is electronically done, all the data has been given in the electronically version. So it will help them to the sharing of the patient's information through this health information exchange. Okay. So what is the benefits of health information exchange? Now, this health information exchange will allow for the secure and potential real-time sharing of the patient information. You know that. Once there is a health information exchange, that means we are really sharing the patient's information accurately. Okay. Now, this way, once we have shared the informations electronically, then it will also reduce the costly tests because once we have done in one organization, if we go to other referral hospital, then we can also they will see the test whatever we have done, and it doesn't need to be repeated, unnecessary tests to be repeated, which is very costly. So it can, in other ways, it can also reduce the cost of the test. Okay. Now this health information exchange will also facilitates the exchange of the information through HIE, which will can result in more cost effective and higher quality care. So once everything has been done in one organization, they can see there, and it will be less expensive for them, and it will be easier for them to see what is the problem, and at the same time there is a less chance of what do you say, time lost, and at the same time they can get the higher quality care. Okay, once it is once you have been referred from one organization to others, if we have spent less time in taking the treatment, in giving the treatment to the patient, that means it will be cost effective as well as there will be a higher quality care of the patients. Okay. Okay. You understood now what is the
Yes,
benefit
ma'am.
of health information?
Yes.
So once we get this
Yes,
health
ma'am.
information exchange from one organization to other by the electronic version, this will give a clear picture of the patient's information, all the clear and pure information of the patient information regarding everything about the complaint, about the test, about the procedure, about the medication they have taken. This will help them to reduce the time as well as the reduce the tests they have already gone, reduce the wastage of money. This will help in more cost-effective and higher quality care of the patients. Okay.
Yes,
Yes,
ma'am.
ma'am.
Okay.
Got it,
What?
ma'am.
Okay. What is the technology involved in electronic health record? Okay. Now, one is picture archiving and communication system, barcoding, radio frequency identification, automated dispensing medications, and electronic medication administrative records. Okay. So one by one, we are going to say, okay, what is this picture archiving and communication system? This technology captures the pictures and integrate a diagnostic and analytical images from various devices. After capturing this, they will put all this whatever diagnostic and analytical images you have, like in X-ray, MIR, CT scan, whatever. They will store them and disseminate them to the medical records. Got it? Disseminate means distributions. Okay. So they will capture all this technology will capture the images, whatever from whatever therapy, whatever diagnosis you have gone through it, and they will try to store them. And whenever it is needed, they will be disseminating this to the medical records. Okay. Okay. This system is especially is very important. Okay, so from one department to another department can also send, and it is a medical records also. So yeah, we have a medical record system here outside, right? So whatever care you have given to the ward, that has to be. We have a what do you call in that OPD wherever we do that MRD, na? MRD means what? We have a medical record system in NEIGHRIMS. Yes. So whatever care you have given in
Yes,
the
ma'am.
ward, yeah, whatever care you have given in the ward and documented in the electronic version, in MRT also there is a system. It has to be matched. Okay, because all the billings has to be done right. So whatever care, whatever medication you have, whatever test they have, it has to match whatever you have given in the ward. Okay, so that they can do the billing process. Because at the last they are going to do billing process, right? You understood or not? What I'm saying?
Yes, ma'am.
Hmm.
Yes,
Okay.
Yes,
ma'am.
ma'am.
So I'm just talking like whatever care you give in one word that has to match in the medical record department so that they can see it is matching and they do the billing processes and can give to the patient. Okay, so it has to be matched. Okay, now after this picture archiving and communication system, we have barcode. This is actually barcoding. You know what is barcoding, right? Whenever we go to departmental shop, what they do? They have a scanner, na, right? They scan
Yes,
the
Yes,
ma'am.
product.
ma'am.
They can scan the product and can see everything whatever it is there. So same thing here also. It's a barcoding. It is an optical scanner used to electronical capture information and coded on a product. So you will see what are those whatever information is there in the product. You can do it. So this can also be done in the electronic health records. Okay. So it has a barcode reader. It has a portable computer with wireless connection. Okay. So here with the barcoding, the nurse can verify the drugs as well as the patients also. Okay. Understood na this one?
Yes,
Yes,
ma'am.
ma'am.
Okay. Now radio frequency identification. Now this technology tracks the patients throughout the hospitals and links the lab and medication linking through the wireless communication system. Now this radio frequency identification, it is also one of the technology in the electronic health records where they can track with this technology, they can track the patient throughout the hospital. At the same time, they can link anything about in the lab also, and whatever medication they wanted to give to the patient, they can link through this wireless communication system also. Once when I was in Padmeshwari, I went to Vellore. Okay, in the Vellore hospital, they have this electronic health records. Okay, so if they wanted to send any medication to the patient, they have the link, communications link, they can send. And even in the suppose you have you wanted to take blood test, you can draw the blood and can there will be some coding there, they will paste it there and they can send this um, in the laboratory through the pipe system also. Okay, so many of the hospitals outside they have this electronic health records also. With this, they can send even the laboratory test also to the laboratory. Okay.
Yes, ma'am.
Yes, ma'am.
Okay. Next is we have automated dispensing medicines. Okay. Here it is also a computerized drug storage devices which allows medication to stored and dispense near the point of care while controlling and tracking the drug distributions. So here also it is a drug. It is one of the computerized drug storage devices. Okay. They will store it and they will dispense to the particular patients. Okay. At the same time, they can control and track the drug distribution also. So it is a computerized storage devices. Okay. Now with this, what will happen? It will reduce the pharmacy labor by 90%. Okay. They don't have to do so much work pharmacist. Then reduce the technical labor by 72%. Cuts the missing medication by 92%. No medication will be missing out, and lower the expired medication cost by 54%. Okay, this automated dispensing medication will help to reduce all these things. Okay, and even the time, they reduces the time also. Understood this one? Yes or no?
Yes, ma'am.
So, so we have seen the component. First component was what? Clinical decision support system. Okay. Then we have a computerized physician order entry. Then we have a health information exchange, right? So we have seen the function of it. Now, what are the technological involved in this? We have seen, and now we will see what are the benefit of electronic health records. Now, I told you it improves the access to the medical report. Okay. It will decrease the time spent in documentations. I told you already. Increase the time for client care. I have already told you. Okay. Improve the quality care. Then next is read out. Read out anyone.
Benefit of EHR. First is improve access to the medical report, decrease time spent in documentation, increase time for claim, improve quality care, facilitation of data collection research, and improve communication, creation of a lifetime clinical record facilitated by information system.
Okay. Okay. So you have seen, no? So it improves the quality care, facilitation of data collection for research, whatever data collection of the patient. This can be taken as a tool for research work. Then it can also improve your communication, creation of lifetime clinical record. Once you have put your records in the computerization, that it is the record is already there for your information in the information for the lifetime. Okay, okay,
Okay,
okay,
ma'am.
okay. Now
Yes, ma'am.
okay, now the drawbacks. We have seen the benefits. Okay, now the drawbacks of this one. One is, to run all this computerized system, we need a money, right? Budgeting is very important. So financial issues will be there, adoption and implementing the cost. There may be some change in the workflows. Okay, loss of productivity may be due to issues, financial issues, and sometimes the patient doesn't want to give all those information because of the privacy and security concern also. So this may be mm, and sometimes there will be a ongoing maintenance cost will be there. Then sometimes there may be a what you call implemented to run all this computerized system. It has we need lots of money, right? Budgeting is very important. So this may be issue in some organizations also. Okay, got it?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Do you understand what I'm teaching you now? So I have already told you what is a patient record. Okay,
Yes, ma'am.
all the patients recollection of documents for the patients. Okay, now we have two system: electronic patient record system, computerized patient record system. Now in this it is an electronic version of the client's data found in the traditional paper record. Okay, then what is the role of electronic health record? I have told you it represents the patient's health records, medium of communications. There is a communication. There will be a legal document for the healthcare system. Then it is a clinical outcome and tool for research. Then it is also helpful for the educationer, for the practitioner. and it gives you lots of alerts about the drugs, about the patients, about, then they can give you the, if there's any missing dose of medication, they can give you reminders, and as the last, there will be a quality improvement of the patient's care. Okay. Now, what are the documents as a nurse you have to put? I told you it is admission, nursing note, daily charting, physical assessment, whatever you do, nursing care plan. Okay. Everything has to be put, has to be documented, and at last it is also referable and discharge history. Okay. Then component I've told you, it is a clinical decision support, which is all these other software which will help you or assist you in providing in making the decisions. Okay. The function of
Yes, ma'am.
CDSS. Okay. Managing clinical complexities, monitor medications errors, avoiding duplication and unnecessary tests, supporting the clinical diagnosis and treatment, using of best practices and giving you the latest information about the drugs. Then course referring a patient allergy to medications and alert for drug interaction and other potential patient issues. Then we have a computerized physician orders where they can directly put, it is a software where they directly put into the computer rather than doing into the paper. Okay. So what are the things they have to put? It's all these drugs, laboratory tests, diagnosis, radiologists, physical therapy, whatever. And I told you that it can eliminate many errors, medical errors. Okay. Maybe due to penmanship, poor penmanship, maybe due to unclear telephones. Okay. And this will help you to um, uh, giving more efficient care to the patients regarding medications or pharmacy staff whenever giving medications, so that because they don't have to ask clarification again and again from incomplete orders. Okay. And at last, with all this thing, if there is elimination of all these errors, they will enhance the patient safety. Okay. And health information system is the process of sharing the patient's electronically information to the other organizations so that they can give an effective delivery of the healthcare. Okay. And once they give all the sharings, that means they will give purely the sharing of this. It will reduce the costly test. It will reduce the time so that they give a, at the same time they can give a higher quality care. Okay. And what are the technology involved in EHR is? I told you picture achieving and communication system, barcoding, radio frequency, identification, automatic dispensing medications, where they can automatically dispense the medication to the point of care they want. Okay. And at the same time, you also have to do medication administrative record also is very important. So I told you what is a picture achieving and communication system. I told you barcoding, then radio frequency identifications, automated dispensing medications, and what are the benefit of EHR and what are the drawbacks. Okay. Okay. Then
Yes,
this electronic health is one of the uh, approaches where we can give a good quality care of the patient and cost reduction. Okay. But the problem is but the main drawback is there are two categories of barriers. Okay, that is, one is your what do you call the financial issues and the change in the workflows. Okay, but if these are the challenges where we can if we think these are the challenges, then there will be a lot of efficient patients care or a delivery of healthcare system to the patients efficiently. Okay. So
Yes,
yes,
one
ma'am.
of the conclusion is human barriers and one is the financial issues. If these are the, if you think this is a challenge, we can come out and implement it, this electronic health records, and this will help as a whole. It will help to give a cost-effective or quality care to the patient. Okay, students, thank you so much.